Surveillance is the ongoing and systematic collection, analysis, and the interpretation of health-related data essential to the planning, implementation, and evaluation of service delivery and public health. Today, the Ministry of Health has launched an updated and third edition of the Integrated Disease Surveillance and Response, and here is why.
In the West African region, we had the Ebola outbreak that ravaged quite a number of countries that side. We've had the Zika virus outbreak, we've had the yellow fever in DRC, and of late we have the COVID-19. And so because of all these outbreaks, it was paramount that we moved to another edition.
The Assistant Commissioner for Surveillance, Dr. Michael Mwanga, says they now need money to fully operationalize the guidelines.
The total requirement for the IDSR rollout is, in terms of Uganda shillings, is 12 billion. So far we've had commitment of 8 billion, and the funding gap is 3.7 billion.
He says the increased risk, emergence of new infections and disease outbreaks, coupled with new technology, also prompted the need to improve the existing guidelines.
We already have a pool of national trainers as we go to the districts to roll out. We already have people who can be able to roll these guidelines to the districts.
State Minister for Health in charge of general duties, Anifa Kawoya, launched the guidelines.
All these development efforts will make the country fulfill her international obligations of complying with the IHR 2005, and we are working towards that commitment.
Walter Mwesije, NTV.